Okay, so I told you guys, I said, me, no worry. Everything we guys do with health, now Dr. Bad go to relate with you guys on the show today. But then we know, say, the most important thing where they share right now will be actually make the world a standstill. Yes, actually took the world by surprise. Now it be the pandemic, talking about coronavirus. Yes, we are happy, we're excited with the progress in terms of vaccine. But then we keep asking ourselves, why do we keep having increase in numbers? Why are people still being, infected or whatever in terms of this virus? Anyways, the experts in the building are talking about the person sabi do and pass. So, but the way Baba go there give, you understand? This is what he does for a living, and it's always a pleasure to have Dr. Bat in the studio this morning.
Of them all.
Doctor, yes.
Good morning.
Good morning. How are you doing?
You're looking lovely as
Thank
always.
Thank you.
I
Compliment
like your
of the
hairdo.
season.
Yeah, they sent to you. Yeah.
So I know we are still on coronavirus.
Yes, we'll be looking at updates on vaccine.
Oh,
okay.
At least I was right.
Yes, very correct. Good morning, viewers at home and around the world. Compliments of the season to you all. Today we'll be looking at updates with respect to COVID-19 or coronavirus vaccine advancement. What do we need to know? But before we go into all of that, let's look at where we are today in terms of the caseload we have globally. Earlier this morning, when I was looking at the numbers, when I saw 66 million, I was wondering, was it just, how did we get here? It was a question I couldn't answer myself. And I started looking at the figures. Should there be a calculation error? And lo and behold, after doing my permutation, I realized there was none. So as of today, going by the statistics I have with me from Worldometer, that's my source. Okay, not overtly different from what Johns Hopkins University data also shows. So as of today, globally, over 66 million people have been infected. Of course, this includes the number of people who have recovered as well.
Okay.
And
so
as well
that
as
means
people,
in total?
Yes, in total. As well as people who unfortunately have paid the supreme price, as well as because of COVID-related challenges. Okay. So 66,228,305 persons have been infected till date. And of course, out of this figure, 1,524,348 persons, unfortunately, have died to this COVID contagion. Suffice also to say that over 45 million individuals have recovered from COVID-19. At the moment, over 18 million people are currently infected globally, and 106,135 individuals are said to be in serious or critical condition. US still stands at the topmost of the chart with 14,772,536 persons are currently infected, almost close to 15 million in the US. It's no longer news that for about 3 weeks now, they've been having almost an upsurge that have hovered between over 200,000 and above over a space of 2 to 3 weeks now. And of course, talking about the fatalities anyway, in the last 24 hours, the new cases in the US was over 235,272. And about 14 countries of the world have gone over the 1 million mark. 14 countries of the world. Iran sits at number 14th with 1,016,835 persons infected in that country. India comes second to the US with over 9.6 million persons infected. Brazil currently on third with over 6.5 million individuals infected. Russia has about 2.4 million caseload. And of course, France has about 2.2 million. Spain has about 1.6, UK has about 1.6 as well, Italy 1.6, Argentina 1.4 million, Colombia 1.3 million. Let's take a look at what we have in African sub-region. South Africa at the moment is nearing 1 million mark of caseload of COVID-19, with 804 individuals currently infected in South Africa. New cases over the last 24 hours in South Africa stands as 4,932. Morocco comes second in Africa with 372,620 persons infected with COVID-19. New cases in Morocco over the last 24 hours stands at 3,996. And of course, you have Egypt, Ethiopia, Tunisia, Kenya, Algeria, Libya, and Nigeria, our own dear country, currently sitting at number 9th position in Africa with 68,000, I beg your pardon, 627 persons have been infected in Nigeria. And of course, in the last 24 hours, we have seen 324 new cases. I also want to point out that we now have an upsurge in the number of cases in Nigeria. For a very long time, we've not had a caseload as high as 300, but we had that 2 days ago. Yes, we had over 300 2 days ago, 343 new cases 2 days ago, and of course today we have, yes, you can see that on the screen.
This was on the 3rd,
yes.
343 on the 3rd.
And in the last 24 hours, 424 new cases. Now, in the words of Dr. Anthony Fauci, who said that hope is on the way, that help is on the way, that help is coming. Why did he say so? With respect to the advancements that the scientific community has made in COVID-19 vaccine. As it stands, as of today, my source is New York Times Vaccine Tracker. 41 vaccines are currently in phase 1, while you have 17 vaccine candidates in phase 2, and you have 13 vaccine candidates in phase 3. About 7 of the vaccine candidates so far have gotten emergency use authorization. The latest of them all being the Pfizer-BioNTech vaccine that was recently approved or got emergency use authorization in the UK, and earlier hours of this morning also in Bahrain. So 2 countries of the world have actually given emergency use authorization for Pfizer and BioNTech COVID-19 vaccine candidate. And I also want to say that at the moment, none of those vaccines have gotten final approval.
I was about asking that, is he on 100 now?
No.
Last time he said it was 90 or thereabout.
So final approval, none yet. Okay, but there is hope in sight. There is hope in sight, and we're happy about that. In the month of November, at about the 9th of November, Pfizer and BioNTech actually gave preliminary data analysis of their vaccine candidates. And of course, they told the world that it was about 94% efficacious. Okay? Within a space of 1 week or thereabout, Moderna also came out with their own vaccine candidate and equally said theirs has an efficacy rate of more than 95%. As a matter of fact, Moderna scientists were actually the first set of people to actually commence human trial with COVID-19 vaccine. But as it stands, we are hoping that as early as next week, mass vaccination campaign can commence in a number of countries of the world. Okay? But there are still a whole lot of challenges, ranging from challenges with storage of the vaccine to distribution. Now, the major challenges that they're encountering at the moment is their inability to meet up with the number required. But at least it's better to have started from somewhere. Also, China has said that they are getting prepared to vaccinate as many as 600 million people in the month of December alone in China.
This very month.
Yes, in this very month. So there's a lot that are happening on a global scale. Okay, for instance, let me give you an idea of how these vaccines work. Now, the essence of doing this is to prepare our mind, because I must tell you, because of all the political interference that have crept into medicine lately, a lot of people are expressing some form of skepticism over the vaccine. Okay, a whole lot of apathy about the vaccine. Okay, so the world leaders at the moment are trying to rev up, are trying to make moves to encourage people to present themselves to receive this vaccine, because as it stands, that is the only hope for humanity. Okay? As a result of that, 3 past American presidents, talking about Barack Obama, and Bill Clinton, as well as Bush.
Yes, they said they were going to.
They've actually come out to say that they will take the vaccine openly.
Yes, I saw.
But they gave a precondition.
Oh, really?
Yeah, the precondition is that if Anthony Fauci certifies that those vaccines are safe, and you can imagine that.
So until then.
Yes. And then, of course, they will make themselves available.
Okay.
Now,
we are supposed to go for it.
Yes.
Okay, so guys, let's go for a break, and then when we come back, Dr. Bag will continue.
My people, now is the time to wash your hands a little more.
Keep a bit of a distance between you and your neighbor.
Try to stay for house. You know yourself. You know yourself.
But if you must go out, don't forget to put your mask on, Niger.
It is important to wear that mask.
Not below your nose.
Or as an ear accessory.
Not as a necklace.
Or eye cover.
Eye cover no be mask.
Wear your mask now.
That mask. Well, no. I understand. It might feel uncomfortable.
But better a mask than a ventilator.
You say reason am life no get part 2.
This virus is real. It's not fake. It is not a hoax.
People complain it messes up my shekara.
Oh, it messes with my swag.
Covers my makeup.
Just remember that without that mask, it's not just your life you put at risk.
So put your mask on, Niger.
Soon everywhere will reopen fully.
Schools,
restaurants,
Clubs,
malls,
churches, and mosques.
But let us not forget,
COVID-19 is still with us.
So until we defeat this virus, let's do without the hugs, kisses,
and the high fives.
and remember to keep our distance.
We can end this pandemic
If we all, that is me, you, do our part.
My mask protects you, and your mask protects me.
Put your mask on, Niger.
Put your mask on, Niger. Put your mask on, Niger.
My name is Yaya Bisu.
Awele Okibo.
Kole Shetima.
Amaran Wampa.
My name is Yinka Falola Anemwa.
My name is Foyeke Adebago, and COVID-19 stops with me.
There are a lot of false information about the coronavirus. These are the facts. People of all ages can be affected by the coronavirus. However, older people and people with pre-existing medical conditions such as asthma, diabetes, heart diseases are more vulnerable to the disease. It is not for old people alone. Gargling salt and warm water or chewing garlic and ginger cannot prevent the virus. Drinking alcohol, hot lemon, palm oil, or chloroquine will not kill the virus. The virus cannot be transmitted through mosquito bites. Antibiotics do not work against the viruses. Antibiotics work only against bacteria. Boiling pineapple peels, lime, and ginger does not kill the virus. Putting raw onions in rooms will not ward off the virus. Using or spraying Dettol, special oils, and water all over your body cannot kill the virus. There is no scientific evidence that cooking, drinking, or eating any of these is an effective treatment for coronavirus. Do not self-medicate and take responsibility by sharing only verified messages from health authorities such as NCDC, Federal Ministry of Health, and WHO.
How do I get tested? If you fall into any of these previously mentioned categories, remain in self-isolation and immediately call your state hotline or the NCDC toll-free line on the screen. The State Ministry of Health, supported by NCDC, will arrange for sample collection and transportation to the lab. Where can I get tested? There are several labs across Nigeria for the testing of COVID-19, and these labs are currently rapidly being expanded across the country to reduce turnaround time from when the samples are taken to when they are tested for the disease. And you can only get tested if you fit the criteria as previously mentioned, and a sample has been collected for testing by the state team. What do I do if my COVID-19 test is positive? If your result is positive, please do not panic. Many people who have the infection will show mild symptoms and they can recover quickly with just supportive care. And most of the cases recorded till date in Nigeria are mild to moderate and are clinically stable. What do I do if my COVID-19 test is negative? If your result is negative, it means that you are not infected at the time your sample was taken. However, it is still possible to get infected. Therefore, you should continue to practice social distancing. Wash your hands with soap and running water all the time. Use alcohol-based hand rub frequently and clean your environment all the time. Should I come to the Nigeria Center for Disease Control to get tested? No. If you fall into any of these previously mentioned categories, please remain in self-isolation and immediately call your state hotline or the NCDC toll-free line on the screen.
Hello, my name is Dr. Kenny, and I want to share some life-saving information with those of you above age 60, like me. At our age, we are at a much higher risk of severe illness and even death if we contract the COVID-19 virus. Also, those of us with underlying health conditions like cardiovascular disease, diabetes, chronic respiratory disease, cancer, and obesity also face the same danger. However, we can prevent and stop the spread of COVID-19 by ensuring we stay at home as much as possible. Wash hands with soap and water, sanitize hands and surfaces, wear face masks when in public, avoid crowds and maintain physical distance, and importantly, stay away from people without face masks worn properly over their nose and mouth. COVID-19 is endangering more and more Nigerians, so please protect yourself and others. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
The truth is, no matter how adamant some people have chosen to be, no matter how stubborn, no matter how, they give an I don't care attitude, they should say health officials, government authorities, people like us, media practitioners, will actually not get tired of telling you all you need to know about the virus. You know why? Just because say we care. It is really, really important. So before we go on that break, Dr. Babi actually gave us, he's done so well, and trust me, I can't stop to say thank you, Dr. Follis, bringing us up to date with necessary information that we need to know about the pandemic. So he mentioned the fact that over 66 million people now don't get infected, and of course we've had over 1 million deaths, worldwide. But the cocoa be say, I get a couple of questions here, Doctor. Why I don't write? I wrote like 5 questions, but I'll take my time to, take each of them. So the first one, I watched the clip on the mask, and you attest to the fact that outside the fact that we've got different facial masks these days, I see different types. Some now don't even customize them. So if they are doing lace, they wear the lace type and all of that. So it's become fancy. Fashionable. So now, doctor, really, how important is the wearing of face mask? Because I would have suggested, like I was on breakfast and I was, talking about we social distancing ourselves and all of that. So how important is the wearing of face masks? Like how effective it is?
Thank you very much for that very important question. Before now, some of the complaints that people were given with respect to face masks is that they're expensive, they're not affordable, they can't get to buy. But all of that are in the past now. Anybody who wishes to wear one can easily get one. In fact, they are sold as they're as cheap as 100 naira per one. In a number of places in Lagos. So you do not have any excuse anymore not to wear your face mask. Now, the newly elected American president, Joe Biden, actually said that one of the things he will beg Americans to do is to wear face mask for just 100 days. 100 days. He wants a mandate in place for Americans to wear face masks for just 100 days. That if they can do that, that it will go a long way. But some health practitioners are equally saying that 100 days is even far too much. That if Americans, majority of them can wear the face mask for just 2 weeks, it will make a whole lot of difference with respect to what they're facing now. They're almost hitting 15 million in terms of their own caseload there. And we can't stop emphasizing the importance of putting on a face mask. When you wear a face mask and I wear one, I protect you and you also protect me. Okay, so we'll call it source control. Okay, because you can't, because of asymptomatic nature of the majority of people who may be infected may be asymptomatic, it's difficult to actually say who has it and who does not have it. Sometime in the month of November, we got the news that NYSC orientation camp.
Yeah, they had over 100.
That about 38,000 or thereabout were screened, and a lot of them were discovered.
More than 100 papers carried it.
Yes, and about 300 or so of them were discovered to be infected. Now that is how far it can go. Okay, CDC is even emphasizing and advising Americans to even wear face masks, even indoors, within families. Now it is that bad. What the face mask can do is that it helps you to stop the spread of the infection. It helps you to stop it because it's not all the time that you'll be able to effectively do social distancing. So the importance of wearing face mask cannot be overruled. We can never stop talking about the use of face masks as a public health measure in preventing COVID-19. I was discussing with a friend just yesterday night. He traveled to the east and he was back. And he told me that if anybody sees you, now why we got talking was because I wore a face mask and stepped into his hotel room. So he told me that if I step into the east with this face mask, I'll be seen as an alien. People will be looking at me. People will be looking at me as what message is this man trying to prove? Now, we shouldn't take our luck too far. The truth of the matter is that Nigerians, we do know, not just Nigerians, Africans, the degree of fatalities that are being experienced abroad in Western world are not the same with what we have here. And we have alluded some scientific reasons to it, a whole lot of them that may be responsible for what we are seeing. The fact that we have been fortunate doesn't mean that a good number of us have not died as a result of this.
Definitely.
A whole lot of people who may have died as a result of COVID-19, we have
Ted let's take Ted from Benue. Hello, Ted. Good morning.
How are you?
I'm very well, sir. How are you doing today?
Fine. I want to ask you, why are you not wearing...
Don't worry, call us back. All right.
But you can actually. He's asking why are you not putting on face mask? Now, the truth of the matter is that if he's a regular, on Health Matta, he will actually know that usually before now we used to have as many as 3 people or 4 people seated on those tables. Now, but because of the COVID-19, we have to
distance ourselves.
Yes.
So far off.
Okay, so, and of course, you discover that in major studios across the globe, not all the time that you can see people in the studio putting on face masks. So the social distancing does that for us here. Thank you very much.
Okay. All right, Doctor, you actually brought up another question that I wrote here. You know, you mentioned the Western world, and truly, if you had to compare the number of people that get infected, like you said, in the US, I think you had like over 235,272 people actually got infected just between, I think, the space of yesterday and today. Now, some people go to say now weather, now they're responsible. Say, okay, their weather for their day too cold. And obviously here it's a bit, I don't know, I think we have a very good weather. That it is the weather that is actually responsible for us not having too many figures of persons infected. So does the weather have anything to play in this?
Honestly, from a personal, it sounds logical to actually believe that weather may play a prominent role. Okay, but as of now, there is no scientific evidence, okay, to substantiate such a claim that heat can actually reduce the transmission of COVID-19. Now, even in America, even if you say because some people are because of race, talking about tribes, African Americans and some other people of color in the US are known to be disproportionately affected by COVID-19, meaning that more fatalities are noted or have been observed among certain tribes or among certain races in the US. African Americans and Latinos are known to succumb more to the coronavirus pandemic than all other population. But here in Africa, one would have expected to have something similar to that, but unfortunately it is not. But let me also mention some of the scientific evidences or that people or hypotheses or that people have talked about that may be responsible for why we are seeing less number of fatalities in this part of the world. Number one is the fact that African population, we have more of youths in Africa. So we have we have more of youthful population than the elderly. Okay, you can't compare that with countries like Italy and Japan that are said to be the two nations that have highest number of the elderly groups. Okay, now because of our youthful population, it's a well-known fact that youths are not likely to have many of the underlying conditions, medical conditions that the elderly that can be found in elderly. In medicine, it is known the number of disease conditions are found more in the elderly. Okay, so as one is growing older and older,
exposed to
you may pick a number of baggages along the line. Now, but a young man of say 20 or 16 years, 25 years is not likely to have prostate cancer. Is not likely to have benign prostatic hyperplasia and a number of other medical conditions that are seen in the elderly. So as a result of this youthful population, we are able to resist some of this as a result of the robust immunity that are usually found in the young. That's one. Number two is that another factor that has been implicated is the fact that people who are deficient in vitamin D are known to have worse outcome when they are infected with COVID-19. In the whole of our African sub-region, we have plenty of sun and abundance of sun in almost all the African sub-regions. So, and of course, vitamin D, one of the sources of getting vitamin D is just for you to come under the morning sun. And of course, you have plenty of that. Now, because you are not likely to have a lot of vitamin D deficiency in this environment, that has also been touted as one of the things that could help us. Okay. Now, apart from this, some immunizations that Africans took religiously some decades ago are also touted to have been helpful to us somehow, but some of these things are not proven yet. So it's still a big surprise to the scientific community. They can't categorically say this and this
is what is responsible.
Yes, is responsible for why we are seeing lesser fatalities in African sub-region. But that is not to say that the figures are not climbing. Look at some of the African countries before now. Nigeria used to be number 5 on the worst hit countries in Africa. But today we have dropped to number 9, okay, on the list.
Should we say we are doing something good?
Yes, we've made a lot of efforts. We have made a lot of achievements. We have been able to build on the foundation that we laid early enough in the pandemic. For instance, the number of tests that we have done so far is getting to 800,000. Okay, so let me give you the specific number of tests that we have done so far. When we started, the number of countries were far, far ahead of us in terms of testing capacity. Ghana, for instance, was far ahead of Nigeria and a whole lot of others. But that's not anymore. At the moment, the total number of tests that Nigeria has done is 791,530. Okay, so we're almost hitting 800,000. And of course, Ghana, that used to be on top of us, we've gone above them. Egypt used also to slag behind, but they've also improved. So a lot of improvements have actually happened in terms of ability to test and all that.
Okay.
We'll go in the short break and we'll be right back.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Babarisi, you been dey sleep when government motor show for inside area this afternoon. No. Now so them take enter Sisi Clara house where dey the other side. They come comot with some kind medical equipment. But it be like say she don't catch the coronavirus where people they yarn about. Oh, we self we no safe for inside area again. No, kai, I no go even pass that house again.
Mama Risi, haba. Sure you no know say they good make government to check everybody where they suspect say they don't contact with people who don't carry the virus. You know mean say they get them now. Even if you say the person get them, it means say they go just carry them, make he collect treatment. If person get the coronavirus, you know mean say the person don't die. Person fit still recover. Or when they don't suspect say somebody get them, then go do test. They fit even treat the person fast. Plenty people will catch the virus. After they collect treatment, they recover. When these government people come, make we allow them, make them test you.
This message now from the Federal and State Ministries of Health, Ministry of Information, NCDC, and them partners them.
We all know wearing a face mask is not very comfortable, but the risk of getting infected with coronavirus is much higher when you are in public without a face mask. Ensure your nose and mouth are covered properly while in public places or in a closed area with several people. Wash your hands regularly and maintain social distancing. You are not at risk of getting infected from people who have recovered from the virus. Do not stigmatize against them. Stigmatization increases the chances of community transmission of COVID-19. Remember, anyone can get infected. Together, let's fight COVID-19. This message is brought to you by the Risk Communication and Community Engagement, Public Health Department, Health and Human Services Secretariat, FCT Administration.
Hello? Tunde, it's been ages.
Maka, I'm so tired of this coronavirus pandemic. I am inviting you to my birthday bash next Saturday. All our friends are going to be there.
Wow, that is awesome. But I'm sorry. You know my condition now. I am managing and I can't risk corona.
Amaka, you're on even too much. Corona cannot affect young people like us.
That's not true. Coronavirus affects young and old people, especially those of us with underlying health conditions. We must be very cautious. So I know families who have lost their young ones too.
So this coronavirus is real. I am calling off the party.
Even young people are at risk. Be like Amaka. Do not take risks. Wear your masks correctly if you go out. Wash your hands regularly. Maintain physical distancing. It is better to do over syllables than to regret.
This message is from the Ministry of Health, Ministry of Information, NCDC, and partners.
Everyone has to wear a face mask to reduce the spread of COVID-19. Wearing face masks appropriately can help prevent the spread of COVID-19. So the more you wear your face masks, the better. Whether you are on your way to work, the market, or the bus station, always wear a face mask. When an infected person coughs, they spread tiny droplets filled with the virus into the air. Wearing the mask helps to reduce the amount of virus being spread by an infected person. When wearing a face mask, make sure it covers your nose and mouth. You do not wear it on your neck or under your chin. Avoid touching your mask often. Dispose of it hygienically. Face shields will not protect you from COVID-19. Avoid wearing them. If you must, always wear it with a face mask. Take responsibility. This message is brought to you by the Presidential Task Force on COVID-19.
Welcome back. Of course, still on top of number one family entertainment channel this morning, and I Health Matta. Yes, now the segment we did today. Of course, time on the TV they talk 9:17. I'm saying give or take we get like 10 minutes before carry come up from studio. You still get the opportunity to call us, ask your questions. The same way they ask my ear for inside the studio. So, doctor, you've said so much about vaccine, and obviously when I've been launched the show, you could tell I was quite excited on how far we've come, because I thought we were on 90, but said we are already on 95, which for me is far, like is a very big pass mark.
Yes.
So now my question is, right, how safe can the vaccine get? Because I'm trying to understand why the past president has said, okay, they need to confirm if it's safe first before they can, go for it. And then secondly, now, is it going to be for everybody? I mean, if you are not infected, can you still collect the vaccine, or it has to be strictly for those persons that are infected with the virus?
Yeah, thank you very much. Let me start from where you stopped. Thank you very much for that very important question. Vaccines are given to people who are healthy.
Okay.
Vaccines are given to healthy subjects, not to people who already have the disease. Okay? For instance, let me use a common one that we all know in this environment, hepatitis B vaccine. Before you can take hepatitis B vaccine, one of the criteria is that you need to do hepatitis B screening. Okay? Now, if you do the screening for hepatitis B and C, and you're positive for hepatitis B, you're not qualified to take the vaccine. The same goes for COVID. If you're already infected with COVID, you cannot take the vaccine. You cannot take COVID vaccine. So vaccine is meant for healthy individuals in the population. Now, the essence is this. When you give healthy individuals in the population, when you vaccinate a large percentage of people in the population, you will create what is called herd immunity. So if the infection wants to pick out people, it may be picking out people who are already vaccinated, who themselves will resist the ability to transmit the disease from one person to the other. So that helps to knock off the transmission line. Okay? Now, but in COVID-19 vaccine, the ones that the whole world is speaking about appears to be the vaccine candidate from Pfizer and BioNTech. Pfizer is an American company, while BioNTech is a German company. Pfizer-BioNTech vaccine candidate. That appears to be, as well as the one from Moderna. Now, what is unique about those two vaccine candidates is that they've been able to show that their own data, of course it hasn't been peer-reviewed, has given an efficacy rate of over 90%. One is 94.1, while the other one is 95%. Okay? Now, if we even have a vaccine that can give an efficacy rate of between 50 to 60% is a major breakthrough. To have one that can give as much as 90% is a landmark achievement. Okay, but we need to actually inform our viewers that vaccine will not solve the whole of the problems that are associated with COVID-19. That is what WHO is trying to point out. That this major breakthrough does not on its own mean that COVID-19 pandemic is over. We still need to implement those public health measures of prevention. Okay. Because these vaccines will not confer lifelong immunity. Okay. Now, these two vaccine candidates that we are looking at are actually similar to each other. They are messenger RNA vaccines. Okay, they are genetic vaccine molecules. Okay, now you need to take most of the COVID-19 vaccines that are undergoing trials. One will actually need to take 2 shots to have an appreciable or significant immunity. Okay, now let me take it a little bit further and explain what happens. Now, remember at the beginning when we're talking about COVID-19, we painted the picture of the molecule of coronavirus as a crown with what looks like spikes. Yeah. Just imagine having a bicycle tire with the spoke spreading evenly round about the hub. Okay, so that's how you have the spike protein. Now, this spike protein that are found at the surface of the coronavirus gene or molecule is actually what it uses to attach to the human cells. Once it gets attached to the human cells, it can replicate and make copies, millions of copies of itself that can invade all organs of the body. Now, what the researchers have done, the scientists, is they've created what looks like a blueprint of what looks like that spike protein that uses to invade our body. So when you receive a jab on your shoulder, you get that blueprint of messenger RNA being injected into your system. When it gets into your cells and attaches itself, it produces millions of copies, not of the virus, okay, but of the blueprint of the vaccine candidate that you've received. Now, the body system will identify that as a foreign body, and of course, we want to attack it. It will mount what we refer to as an immune response. That immune response is what will protect such an individual. Of course, it comes with a price. You can actually notice that some small children that are taken to hospital to receive some vaccine, especially a vaccine like measles vaccine, which is a life-attenuated vaccine. After receiving such a vaccine, most of the children who have taken those vaccines will have some degree of fever for say 1 to 2 days. But those fevers are not something that you should worry about. When parents give some painkillers, they're usually taken care of. So that happens even in an adult. So people who are going to take this vaccine should expect to have such presentations within a space of 24 to 48 hours of taking that. That shows you that your body system is trying to mount a response.
Okay.
Based on the foreign body that has entered your system. That response, that's immune antibodies that will be produced in the process, is what will help you to wage war against COVID-19 infection. For instance, the analysis, the data that we got from Moderna vaccine candidate, 196 people. Yes, 196 people who were said to have gotten the vaccine. Don't forget, it's not everybody that will get the vaccine, the active vaccine agent. Some will get placebo, which is just like nothing, but unknown to them. While some people will actually have the active ingredients. Now, out of the 196 people...
Placebo is fake, Abby.
Yes, somehow. It's not the real thing. Okay. So if you say fake, you're not far from the truth. Okay, so out of the 196 people that got injected and felt we've been immunized, don't forget that they were healthy volunteers. 185 of them caught the infection.
So what happened? Means...
Those 185 of them that caught the infection were actually people that received the placebo, not the active agent.
Unfair.
But 11 people among those that took it actually got infected. But what happened that was they didn't end up with a severe disease. So the vaccine can do a number of things for us. It can prevent us from transmitting, it may prevent us from transmitting the infection from one person to the other. Of course, that is what we are looking forward to. And it can also prevent people from getting infected. In situations where they get infected, they may not have the active disease. So that is what happens even with measles vaccine. Not all the children that take measles vaccine will have a lifelong immunity. A few of them, I think about 3% or thereabout, may still have measles. But the effect will not be as disastrous as it would have been should such a child...
did not take.
Yes. If such a child had not taken the measles vaccine. So that is the picture that happens with vaccine.
Okay, thank you very much.
Now, talking about the American president that came out.
Yes, that's what I'm saying.
The past American president that came out to say, they were actually trying to encourage people to come out and get vaccinated, because that is part of the way to, that appears to be the major light that we can see at the end of a very dark tunnel. Because if you look at what is going on in the US, it's mind-boggling. The place has been devastated, much more than any nation of the world. For a country alone to be having as close to 15 million infected cases. And of course, with daily fatalities topping 2,000 over the past 15 days or more is alarming. Is just alarming. And we shouldn't fold our hands in Africa and think nothing is happening in Africa. I can tell you that the resurgence is also beginning to show. In the last 48 hours, we have witnessed 300 case loads of over 300.
We are going back to how it came.
So why is this so? Because we have lost, a good number of us have lost our guard. Those public health measures that we started doing at the initial time, I understand. It's fast becoming a marathon. People are tired. People are getting weary. It's fast becoming a marathon. But we just have to keep faith because hope is on the line.
Okay. Hope is on the line, and it's on that hopeful note that we'll wrap up today's segment of Health Matter. Doctor, as always, always a pleasure. Thank you.
But I have a last question for you before we go. Will you avail yourself of the vaccine if it hits our shores?
If it is... Okay, now we'll choose for the president to get...
Or if Anthony Fauci confirms it.
Then I can. But then we know before it gets here. Anyways, we'll keep our fingers crossed.
But I will take the vaccine if it gets here.
Yeah, I think I should too, right?
Thank you very much.
Yeah, we should anyway. So we'll see you guys next week, Saturday, by His Grace. Thank you for joining us. Have a fabulous weekend.
Yeah.